New videos every day. Life, wisdom.
Hi everybody, this is Dr. Eccles again. Glad to be with you. Today we're going to talk with Miss Corey over here.
Hello.
And I'm going to have her tell you a little bit about some of the problems that she's been having. And then I will tell you a little bit about how we would handle this in a conservative method. But before I do that, let me just tell you a quick little story. Corey's been having some problems with migraine headaches. And I had a patient a while back, and she was suffering greatly with migraine headaches to the extent that she actually had to withdraw from school. So that would put it into the debilitating category. I ran across her doing some screenings one day, and I felt of her neck, and she had this huge knot on her neck. And I said, my God, you know, you've got this huge knot on your neck. Are you having any headaches? Well, when I asked her that, her eyes got about that big, and she says, oh my God, yes. As a matter of fact, I just was sent to a special headache hospital down in Houston. And because of migraine headaches, I had to withdraw from school. And I go, well, what was that like? She said it was awful. They were actually, I had the worst headache of my life while I was at the hospital. And they were taking a hypodermic needle and injecting my scalp with drugs to try to numb the pain. And I was like, that's terrible. And she says, yes. But I asked the neurologist there on staff, one of the head neurologists, I got the insight. I had an intuition that something in my neck might be causing my headaches. And so I was really excited about that. And I wanted, you know, to tell the neurologist and ask him, I go, do you think that there's anything that in my neck that could be causing my headaches? And he looked at her and he said, no, dear, that would be impossible. She was crushed, devastated, and she thought she lost all hope. That next week, when I put my hand on her neck and I said, my God, you've got this huge knot in your neck. Are you having any headaches? It almost knocked her off her chair, and she was ready to get some help. To make a long story not quite so long, we went ahead and gave her some adjustments, realigned her cervical spine or her neck. Her headaches went away. She got enrolled in school, met a nice young man, and now is settled down and having a family. That lady, if we wouldn't have helped her with chiropractic care, she would have been a slave to all kinds of different medications and possibly even worse, maybe surgeries and that kind of thing. So always try a conservative approach first. And I'll show you a little bit about how we'll do that. Let's just start with talking with Corey a little bit about her particular situation. Corey, can you tell me a little bit about what's been going on with your headaches, your migraine headaches? How long have you been having those?
I've been having them for about 2 years now. I have them about every other week to every week usually, to the point nausea, sensitivity to light.
The whole bit.
The whole thing.
So what is it like for you when you get one of those headaches?
Pretty debilitating, really. Not much you can do other than stay inside, turn off all the lights, and just lay in one spot, put a cold rag on my head. Tried medications. They make me feel worse than I did before. I can't function. So,
that sounds awful.
It's not very fun.
Do you know of anything that might have caused this to come on? Was there any kind of trauma, like a car accident or maybe even some kind of upset in your life, or anything that might have happened at that point that you could share with us?
Yeah, actually I had a car accident right around the same time that I started getting the headaches.
Oh, okay.
I know my mom does suffer through a lot of headaches herself. She used to take shots of stuff to kind of keep them away.
Oh my goodness.
Yeah, so it could be either.
So your mom has headaches as well, but you never had them up until the point you got in the automobile accident.
Yes.
Okay. So that's really enough of a reason right there that somebody could have headaches. People don't realize how much force is involved, even in a fender bender. The way you measure force is through, you might remember it from high school, force is equal to mass, which is actually the weight of the vehicle, times the acceleration of the vehicle. Okay, so, you know, if you've got a 3,000-pound car, even if it's going only 10 miles an hour, you know, it's 30,000 pounds of force that's going to go directly into the frame of that car. And some of it is absorbed through the, you know, crunching of the vehicle, but a lot of it goes right through the frame and right into your spine. And that's enough force to shear a telephone pole completely in half. So it could definitely do some damage to your spine, even at low velocities. So it's important to realize that. There can be a lot of soft tissue injury and that kind of thing. So when I would see that, I would probably want to, do a full examination on her and find out exactly if that could be the cause of some of the headaches that she's having. Now, you also mentioned that you were having some TMJ problems. Can you tell? Yeah. TMJ stands for the temporomandibular joint. You don't really need to know that, except it's the jaw. It's what you can feel moving right here. And oftentimes when that's out of alignment, it can be responsible for headaches too. Tell me a little bit about that.
Just started getting it recently, probably last year or so. Having trouble a lot with swelling in the jaw here, a lot of pain. My teeth are always constantly hurting. I think it has a lot to do with the headaches is what I've kind of collected too. It seems to bring them on because of the pain and the swelling.
Oh, I see. So your jaw will start hurting and then your head will start hurting?
Yep.
Does your head ever hurt without your jaw hurting?
Yes.
Okay.
Yes.
So you've got both going on.
Yeah.
Okay. Everybody's entitled to have more than one problem. And oftentimes we'll treat these problems, together. But she's having some TMJ problems. Does it hurt you to eat sometimes? It hurts to open the mouth?
Constantly clamping my mouth shut.
Okay.
Without realizing it.
Okay. Have you seen anybody for this problem?
Nope, my doctor just told me that I had TMJ and to probably not go to the dentist about it and just try and put ice packs on it, try and do night guards, slings, different things like that. So far, nothing's really brought much relief to it.
I see. Do you have any idea why he told you not to go to the dentist for that? Because oftentimes dentists, make guards and things to help you position it properly.
No, he didn't say anything.
Didn't say
that they would treat it like a sore injury and they wouldn't do much about it.
Okay. All right. Well, everybody's got their opinion, I guess. So these are kind of problems that we really love to treat in our clinic. First of all, because they give so much relief to the patient, and there's minimal to no risk involved, as opposed to going in and doing spinal surgery. You've got a lot of risk, or dangerous drugs, and you can't even function really when you're on those medications, right? Yeah. So we want to try to avoid that if at all possible. So a little bit of anatomy. Corey and all of us that are normal, we have 7 bones here in the neck, starting down at the base of the spine. This is called C7, and it goes all the way up to C1, which is called the atlas. You may remember in Greek mythology, Atlas was the guy that held up the world. Well, her whole world is right between her ears, right here, and the atlas is what's holding it up here. Now, oftentimes, if this atlas, through a car accident or a slip or a fall, it could even be through a difficult birth. It could be due to any number of reasons. If that atlas is to shift out of place, it can actually start to build up pressure along the base of the brain stem. The brain actually sends the stem of the brain down into the hole of the atlas during life. Okay, when you're dead, it actually retracts out of there. But in life, it's actually in there. And if that atlas shifts out of place and it puts pressure on the brain stem, do you think that might cause a headache? Yes or yes?
Yes.
Absolutely, yes. And those nerves that come from back here, right in this area, they actually come out of the spine and they radiate back up into the head. So anytime there's pressure there, mechanical pressure, then that can definitely cause a migraine headache. Now, are there other reasons and causes for having migraines? Sure, there can be a lot of them. But this is one of the more common ones that we see. Gallbladder issues can sometimes cause headaches like this. Dehydration, food allergies, there's a whole host of different things that can cause it. But in school, they taught us when you hear hoofbeats, think horses, not zebras. You always want to think of the most common things first and then start eliminating them that way. So what I'd like to do with you is just do a few quick checks with your neck, and then we'll see if we can, and maybe your jaw, and then we'll see if we can't give you some relief. How about that?
Awesome. Sounds great.
Okay. Okay, so we've got Miss Corey on the table. You comfortable? Mm-hmm. Okay, very good. And we've already talked to her about she's got some headaches, some TMJ problems. She's having them really frequently, every, a couple of times a month.
Oh, yeah.
At least, right? Maybe more, yeah? So just so you'll know, a lot of people think that headaches are normal. They're not. If you've got pain anywhere in your body that's not normal, it may be common, but it's not normal. They say that 1 to 2 headaches a year is considered normal, okay? So if you're having more than 1 or 2 a year, there's a problem, and it needs to be figured out what it is and then get it corrected. Otherwise, those problems just kind of tend to get worse and worse and worse as you go on. So headaches are a lot of times I hear my patients say, well, the headaches, it isn't really a problem for me. And that's from a patient's perspective. I just take a few aspirin and I keep going, and that's not a problem. You got to understand from a doctor's perspective, that's a completely a different issue, because maybe the headache is not a problem for you, which in your case, I know it is. But let's say it's just a tension headache and it's not a problem. That the headache is not the problem, but there's something that's causing it, and that could be a problem. You may have a gallbladder that's fixing to go out on you, and they end up having to have surgery for it. You could have some other sort of metabolic disorder that are causing those. So just because the oil light on your car comes on, no big deal, right? It's just a light on your car. It's not affecting you. But what it signifies is very important, and that's the way a doctor will look at it. So a lot of times patients will just brush off the fact that, those headaches don't really bother me. I just take a couple of pills and I'm fine and I'm good, and I've been doing that for years. That's not safe, and it's not a good idea. It's not a good practice. You need to figure out why that is, and so we can be as healthy as we can. Okay, so with Corey, we're going to do a little checking on her neck area up here to find out exactly where the problem is. Push right here for me. I'm just doing a little bit of muscle testing here, and we're trying to locate the problem. Now right here, it's very sensitive, and her arm really gets weak here. And now we're going to determine which direction we need to adjust the vertebra, which I just did. And this is important because a lot of chiropractors out there, they'll just grab your neck and adjust it. And oftentimes that can be great, and it can be fine, and it can really help. But sometimes it doesn't. And if I have found that if you'll adjust the vertebra in the exact way and the direct direction that it needs to be adjusted, you'll get a lot better results. And by using this method that we just did here, I can find the exact vertebra that needs to be adjusted and then find the direction that it needs to be adjusted in. And hers needs to be adjusted there. Oh, that a girl. How'd that feel? Awesome. Very good. Okay, so we gone ahead and made that adjustment. We could hear quite an audible there, so she's got some vertebra in there that really can benefit from being adjusted. Push. We're going to check the other side of her neck now. There it is. Okay. That was good. Push here. Great. So now that we've got her cervical spine or her neck adjusted, does that feel a little bit more relaxed? Feels a lot looser now than it did. Yeah, get a lot of tension built up there when they're out of place. So I'll probably see this young lady again here in the near future to check what we've done and see how her headaches are progressing. So I would like to go ahead and check her TMJ now, which is the joint that we talked about, just to see how that's doing. And I'm going to have you open your mouth for me slow. Put your mouth closed. Now open real slow. Keep it opened all the way. Keep going. Aha, there it goes. So it deviates. Is this one of the sides that it hurts on, or is it more on the other side? It's this side. Okay, I can really feel it when she opens her jaw. It'll deviate down. Okay, open. Okay, and it's tender there. Okay, so let's do this again. Push here. All right. This way. You okay there? Let me get my hand right on this. I'm just going to push up here a little bit. There we go. Yeah, that a girl. So we just moved her TMJ, her jaw, and now when I test it, it's a little bit stronger. Is it as tender now, or is it still pretty tender there?
No.
It's not?
Actually, no.
Okay, so that may have made a big difference just right away. Weird, huh? Yeah, weird. So what has happened is her TMJ was out of place. when a joint gets out of place, folks, it's going to get inflamed. That's all there is to it. So when you touch it, it's going to hurt. It's the same would be true if I was to go down through her back and touch. She may not even know she has a problem there, and then I'll hit a vertebra or a bone there, and she'll go, oh, that's very tender. That signifies that it's inflamed, and it's inflamed because it's out of place. Okay, so we would make the correction there. So this is a real good way if you're having headaches or if you know somebody that is. This is a real good, conservative, easy approach to helping those people have a better quality of life, because people that have this, they would probably do anything to get rid of it. And oftentimes they do. They have to resort to medications, which in her case, she can't even tolerate because they just knock her out too bad. So there are conservative and easy ways to go ahead and handle this. If I can ever be of assistance to you, please don't hesitate to contact me. You can look me up on my website, www.jeffeccles.com. Love to help. Thank you again, and we look forward to seeing you in another video. Thank you. All right. Up you go.